Investors were also encouraged by news that American workers were very productive this past summer, and that's good news for company profits. Productivity increased at its fastest pace in 2 years at an annual rate of 2.9%. That's from July through September. That number blows away the initial estimate of 1.9%. Erica Miller takes a closer look at how technology is helping to boost safety and productivity.
3 years ago, this Long Island hospital had a problem. Healthcare workers weren't cleaning their hands as often as required.
100,000 people die each year in the United States from hospital-acquired infections. That's more than the number of people who die from breast cancer, from auto accidents. It's a huge problem, one that we want to make a dent in.
Lowering the number of infections is also good for the hospital's financial health.
We lose money on hospital-acquired infections. It increases length of stay. It doubles the cost of many operations. We're not reimbursed the same way that we used to for hospital-acquired infections.
So the hospital tried an experiment. It put cameras at the entrance to patient rooms in its intensive care unit, and it tallied how many times workers followed hand hygiene procedures. The compliance rate was less than 10%. But once the hospital started posting the results for the shift publicly, the rate skyrocketed to over 90%. And there were other benefits.
Patients, family, as soon as they see us coming in and out and they see the activity of the hand hygiene in and out, they themselves are using the same methodology.
But even if you don't work in healthcare, remote video auditing may be coming to your workplace. The company that makes this monitoring system predicts that virtually every industry will be using this technology within the next decade.
We're now working in Europe and starting to get going in the Middle East and in Asia. So there's absolutely no bounds to what this can do.
Aerosight's technology is also widely used by the meat industry, in some cases boosting productivity by more than 10%. The biggest barrier to adoption of the technology is not employee backlash. It's money.
The most difficult thing about a new technology or new service is getting companies that didn't have this anywhere in their budget to create a budget line for it.
But North Shore Hospital says its investment has more than paid off.
It probably costs at least $40,000 to treat every serious MRSA infection. If we can eliminate just a handful of those in a year, we've easily paid for it.
Already the hospital is planning to expand its video monitoring to other departments, including improving operating room safety and efficiency. Erica Miller, NPR, Manhasset, New York.